as Jonathan said, I'm Luis Fazenda. I'm very glad to be here and to contribute for the expanding and the general use of this amazing resource that is ozone. And today I'm going to speak about how to use ozone in equine athletes and how can we contribute to optimize their performance. When we go and search what is the reason of poor performance, the studies indicate that poor performance is mainly due to musculoskeletal disorders and respiratory diseases. And I put here oxidative stress because oxidative stress is also one of the main causes of poor performance, but as it's a more recent approach, I don't think that it's generally included in the studies, but I think nowadays it's one of the most important, just together with all the others. In what the World Federation of Equine of Ozone Therapy, what they define the different categories of using ozone in diseases, and the first category of diseases are specifically degenerative and inflammatory orthopedic diseases, and the third category is pulmonary diseases. Today, we are not going to speak about the pulmonary diseases and the approach with ozone. The summary of content of my presentation, we will go through articular pathology, tendon pathology, muscle pathology, and performance. I will give some evidence with studies, either human, veterinary, and in terms of performance, we will speak about the systemic use of ozone. Here we start with the articular pathology, and I show you a first slide that is a summary that I usually, whenever a study comes out in veterinary, I do a table, a summary for myself, and I put you here the product of my summaries. This is a very interesting study made by Vendruscolo. And this study, I think it's interesting because it compares exactly two different concentrations of ozone, and with quite a sufficient number of sessions, 10 sessions. He measured all these substances that you have here on the fourth window of this table, and this study just lacks. There is one aspect here because this study was made in healthy horses, and if we want really to measure all how ozone can contribute, you have to start with joints that are not healthy. Nevertheless, this study contributes to show us how secure ozone is. And I'll show you here one of the articles that for me it's quite remarkable as well. It's the effects of intra-articular ozone injections on serum and synovial tumor necrosis factors. And this study used concentrations of 10, 20, 30, 40, and 50 micrograms per milliliter. And the conclusion was that the injection with 40 micrograms is exactly the one that changes the tumor necrosis factors, and therefore it's the dose to be used whenever joints are infiltrated. In this summary of studies, I put you here an investigation into the efficacy of intra-articular ozone in knee osteoarthritis human patients. I put you here this study because I think this study is relevant for you all to search, for the ones who are interested to further readings and to know more. So having these studies in mind, what I can tell you about my own protocol of injecting joints, I put you here this small table, and my protocol I put you here my protocol, but in fact I don't inject intraarticular. And why? Because we need many infiltrations for effectiveness. Every infiltration here, I suppose it's more or less in every country. I don't know, but here every time we infiltrate a joint, we make the client sign a declaration, everything for infections. Then the costs associated to it every week infiltrating a joint. And then the other contra is that studies, the studies evidence compared with other methods. We have studies comparing ozone with corticos, with hyaluronic acid, with PRP, and that those studies, they show ozone is in fact as effective as one single injection of corticos. Lasts longer, but I think by now I feel towards my clients, I think it's quite difficult to oblige clients to engage in many intraarticular sessions. Therefore, not using ozone directly, I use PRP, and I use PRP activated with ozone, as we will see. I think I pass here to the next slide, and then I come to the other one. So this is my procedure of making the PRP. I have these tubes that come with this gel in the middle. It's much easier to handle the tube without mixing red cells with plasma. Then I take the ozone. I always use antibacterial filter, and prepare everything as sterile as possible. And on the right image, we have already the PRP weight in the plasma, waiting with the ozone. And in one syringe we have the rich plasma, in the other syringe we have the poor PRP. As I prepare, I first prepare this and leave the ozone in contact with the plasma, and then I wash the horse, I clip, I disinfect, so scrub, all the procedures. That takes more or less 15 minutes, and then I infiltrate. Why do I do this? I do this based on the studies of Boschi and Re, who firstly discovered that the contact of heparinized plasma with ozone promotes platelet segregation and therefore increases the growth factors. And Boschi, he published some results with incubation. At the moment, we are not doing incubation for practical reasons. We are thinking about it, maybe arriving to some stables, doing first your orthopedic examination, deciding which horses are going to make PRP, and then collect the blood, leave the blood incubating, and then using it after. And what does Bocci says? He says that the plasma in contact with ozone at 40 micrograms per milliliter increases by 20% the growth factor liberation, and with 80 micrograms increases 68. So I'm not using incubation. I'm injecting a PRP ozonized. I cannot quantify the amount of growth factors that I introduced, but I try to make the best without incubation. The tendon, in terms of tendon pathology, there are very little very little studies. I choose two of the studies that I think they are most interesting. These studies are done with rats and rabbits. Nevertheless, they are really good. The first study, they used a control group, an ozone group, an ozone group, and an ozone PRP group. And by histological cuttings, they evaluated the collagen fibers, and they showed a positive result in the collagen fibers. And in terms of biomechanical strength, there was they couldn't find out if there was a positive result, but they admit that the study was not long enough. The second study, it's very interesting because it's a study not with PRP or ozone in the tendon, but with rectal infiltration. And with this rectal infiltration, they could show that there is positive effects on fibroblast proliferation, on inflammation, and they could also prove that there was a significant higher breaking load and breaking tensile strength of the treatment group compared with the control group. So therefore, these studies make more or less my protocol for tendons, and here is my protocol. I tend to use ozone, never ozone alone. I always use ozone with other therapeutic modalities. Here specifically, I use with ozone, with laser. Sorry. We can use ozone in the tendon either by intralesional injection or by multiple points subcutaneous. Usually the intralesional is within the first week of lesion, and this is done also with the PRP. And then the subsequent follow-ups, I tend to use subcutaneous injection. Here I leave you the concentration. I tend to use close to 30 micrograms once a week, because in fact by practical reasons I cannot go to visit a client more than once a week, and so once a week is not really what is more indicated in terms of benefits, because there are many protocols showing benefits of 2 to 3 infiltrations a week. I can do once a week, and that's the information that I leave you here. And I use these concentrations because these concentrations are the most anti-inflammatory concentrations, close to 30. This is a recent case of a suspensory ligament. The image of the left, one of the first, and this animal received first PRP, and then 2 treatments of subcutaneous infiltrations. And here are on the right side, here are the results with just 15 days interval. In terms of action in the tendons, I leave you this slide here because this slide shows a technique that I developed a few years ago. This technique is a transposition of a human technique used to treat rheumatoid arthritis. And by bandaging with a bandage or an elastic band the fetlock, we will allow higher volume concentration in the pastern, and even I suppose there's no studies, but I think so, that will allow some permeability to the lamina and to the hoof. And I use this equine glove technique for laminitis a lot, or for any podotrochlear syndrome. And when I speak about podotrochlear syndrome, of course, we speak about the insertion of the deep flexor tendon, and that's why it's here on the tendon part. The photo of the right side is exactly the same animal which ultrasound pictures belong. I try to isolate the area where the tendon is affected, and then I infiltrate subcutaneously in order to allow some minutes of a more direct action without the ozone to spread around, because ozone will very, very easily spread to the fetlock, to the hock. So I do this in order to concentrate the ozone, as it's obvious. In terms of muscle pain, I leave you here these studies. The first study is made by the Spanish, the update review in ozone therapy in pain medicine. The second study is made by the Italians, and it's the state-of-the-art of musculoskeletal disorders. And I really, if you want to know more about orthopedics, the use of ozone, I strongly recommend the reading of these two studies. These studies have a review of more than 100 references, and we find very, very useful information in order to create our own protocols. In terms of muscle pain, we have two studies already made with horses. It was Ballardini and Vagliani who made similar studies. The studies are equal in terms of concentration. They use 30 micrograms. They only differ in terms of volume, here 20 to 25 milliliters. And Vigliani, she used 15 milliliters. I think higher volumes can be used because 10 milliliters, it's the dose recommended for paravertebral injection in humans. So I think in horses we can go a little bit augmenting our volume. And here on the right side, we can see that after the first infiltrations, only 6 animals still had pain. And after the second session, only 2 horses proved to be refractory to treatment. So this is the studies that we have as an evidence of using the ozone with horses. And my protocol is more or less the same. I use subcutaneous, I use intramuscular, either paravertebral or supraspinous, but that it depends my echographic evaluation and where the problem resides, or even in acupuncture or trigger points as defined by the ISCO protocol. The concentration is between 15 and 30, having in mind that lower concentrations are more analgesic, higher concentrations are more anti-inflammatory. There are even studies made in humans where they compare now concentrations of 20, 30, and 40. And they discovered that 40, they went even further, testing 60 micrograms. And the study shows that 40 micrograms, it's exactly the most anti-inflammatory. So probably in a being logic, I think we tend to use higher concentrations on acute cases, and as the case goes to chronicity, we should, like just in wound treatment, we should lower our dose in order to go to concentrations as 10 or 15. I write here mainly part of that the interval is mainly part of every weekly visit, because by doing equine athletes, I think dorsal sacroiliac pain is part of every visit, either primary or secondary to problems, to lameness in the limbs. So I think it's always a thing that is done. Here I'm injecting, on the picture I'm injecting with a butterfly system for the subcutaneous injection. The animal can move, and it's quite safe and efficient to use it with the butterfly needles. In terms of performance, here I'm going to give you first an introduction of 3 slides where we see the point of view of conventional medicine, what our colleagues trying to study and to approach performance, because performance nowadays, it runs what is being investigated, it's like running parallel streams. In one side the conventional things, and then in another side the ozone. I just put here that, of course, with exercise, oxygen consumptions increases. It's 24 times higher in humans, but 40 times higher in horses, and 100 to 200 times higher this consumption in the muscles. This increased oxygen consumption implies obviously the production of reactive oxygen species in the mitochondria, and an increased amount of production of this ROS leads us to oxidative stress, and this is the main cause of muscle fiber destruction, which in turn leads to poor performance and lameness. When a big quantity of ROS are present, what occurs is that oxidation of DNA, protein, lipids, and carbohydrates occurs, and the cellular disturbances are particularly important in inflammatory processes, where excess production of oxidants increase the inflammatory process. It's not only the inflammatory processes. Today we know that an excess of ROS also induces a state of hyperalgia, where the animals are just more sensitive and more painful due to the increase of ROS. So therefore is the most relevance and importance to reduce oxidative stress in horses by increase antioxidant levels. And this is one of the most fundamental questions: how do we increase antioxidant levels? What are the other ones doing in order to reply to this question? This is a study just dedicated to oxidative and antioxidative equilibrium in horses. There are loads of study, there are loads of time, loads of money invested in this to investigate these thematics. And this is a summary of studies of vitamins and antioxidants that were done. But mainly the conclusion of this supplementation, you can then I think the slides will be available. You can just see the references and what I wrote more calmly than I'm doing now. This supplementation with vitamins and antioxidants didn't prove until now to change anything, performance, internal antioxidants. So we are here in a situation that solutions should come, but in another way. The ones that we do, that we work with ozone, we know the answer to this question, and we know that ozone can help. When we went through the whole theory of ozone, we know that ozone can contribute to this. So going back to more specifically the horse performance, I love this study of Naoto Suzuki. It was one of the first studies to be done with major autohematotherapy. He used 400 milliliters of blood. The concentration of 20 micrograms per no, this is a total dose of 20 micrograms per kilogram. And he showed, there are other studies before this one, showing how safe it is. You went a little bit further than showing it was safe, and he showed that major hematotherapy increases antioxidant capacity without negatively affecting performance. And one single, because in this study it was done just one single session, and this single session lasts for 7 to 14 days. It's a very important information because we lack these kind of studies. We know that between the 5th and 9th session of a systemic use of ozone, the body starts to produce what is called the super gifted red cells, and other major consequences in the body. So therefore, I tend to do 5 sessions at least, which with each case when it's to increment performance. But we don't have any study that tells us how much these 5 sessions, how much 10 sessions will last. We have a very curious study made by the Russians, done with human diabetic patients, where they did, I think they did 20 sessions of rectal insufficiency, and they could reverse diabetes for 6 months. So I asked myself, how long can we have positive effects? The protocol for performance is by using systemic applications of ozone. These systemic applications, they are the main therapy for oxidative stress, but they are also a therapeutical complement for disease, as it is shown, for example, the study that we saw with the tendons, where rectal insufflation is used to ameliorate the healing of the tendon. And we have also some studies made with humans, where I think, for example, there's one with the arthrosis of the temporomandibular joint, where they used also a systemic approach, showing positive results. These systemic approaches, one of the main rules, the basic rules of ozone: start slow, go slow. It's necessary to investigate oxidative stress by doing individual analysis to every horse, and we can do this by rectal insufflation, major autohematotherapy, ozonized Ringer lactate or saline solution, or by direct intravenous administration, and now I will speak a little bit about each one of them. This rule is applied to rectal insufflation as for all the others. That is to
a couple minutes left too.
To see our doses according to the oxidative stress. Start always with low doses and then increment 5 micrograms each time. I love to do rectal insufflation. In humans, it was started having its success due to the use in pediatrics, in geriatrics. I think all the concerns and the things that I talked about, the used in humans here in the animals, it's not really a problem. It's very, very easy to perform. It's very, very cost effective. The horse of the left underwent surgery, and I'm doing rectal ozone on it. The second one has a laminitis. The third one, it's a case of a muscle pathology, and the last one is a racehorse that is just doing our normal session for performance. I leave here a description of the technique. That it's not that it's just as you see even in the pictures. There is a catheter, there is a tube. You regulate all the settings in our machine and in the bottle, and that's it. In terms here, it's important in terms of volume and concentration. In terms of volume, Bocci defined in his book, he always spoke about the content of the lumen and how this content interferes with ozone, and we are never sure about the quantity that is absorbed. Nevertheless, the German School of Ozone Therapy, they created a rule that I follow, that is we should use doses 3 times higher doing rectal insufflation than using major autohematotherapy. In terms of concentration, very, very quickly, we should never use more than 40 micrograms per milliliter, because this creates an irritation of the enterocyte. Higher concentrations, I leave here some of the indications of higher concentrations. In terms of volume, I want to leave the idea that the volume is very, very important, because the volume will make us the total dose of ozone that is administered, and this is very important for our calculations as well. In terms of volumes, we have a wide range, because the studies with ozone, it was Carpendale. I think Carpendale is the human medicine New York that started treating patients in the 80s. 300 milliliters in a human is already a big dose. He gave 1 liter, 300 milliliters, and without any consequences. So with the studies, I see that from 1 liter to 4 liters, it's more or less the normal range of those for horses. This is my protocol for horses, where I use 2 liters, because I use 400 milliliters. By rule, I use 400 milliliters per each 100 kilos. And then I establish a protocol of increasing concentration, and that I have here, of course, the total dose. In terms of, I'm going to try to be fast. In terms of major autohematotherapy, major autohematotherapy, it's defined the volume to be taken, and the first protocol was published by Scrolaveza. He does it in a transfusion, in a blood transfusion bag. Then the protocol, I leave you here, the protocol done by Suzuki. And basically what I do is the same protocol done by Suzuki in terms of methodology, in terms of preparing the blood, everything. I just do it in a glass bottle, withdrawing 500 milliliters of blood. I start with a concentration of 20, and I never go higher than 50 micrograms. And everybody uses the same anticoagulant, that is sodium citrate. This is the image of the bottle that I use. And after collecting the blood, that is the image in the middle, then after allowing the ozone to react with the blood, I turn the bottle and of course reinfuse the blood. In terms of when this study came out, I was very, very happy because finally something compared different approaches of systemic therapies. And this study compares autohematotherapy with rectal insufflation. And I'm going to have a critical with you all. I'm going to have a critical analysis after what was said. I'm going to have a critical analysis over this study, and 600 milliliters of blood was collected from each horse. And I think this amount is within the normal amount of blood, and 60 micrograms per milliliter. Here, I don't think it surpasses the 50 rule. I think it's just too high. It damages the red cells. And in terms of rectal insufflation, we see that the volume is also okay, but a concentration, a total dose of 15 micrograms per kilogram was given. So in a horse of 500 kilos, we have 7,500 micrograms against 36,000 micrograms of major autohematotherapy. So this study doesn't follow the rule of the German ozone school, which defines a threefold augmentation of the rectal insufflation. Nevertheless, this study showed no statistical difference between the two methods, which I think it's amazing. And of course, like every time, further studies are necessary. In terms of saline solution, I leave here, I just raised the debate and the big war between the different points of view, that is the World Federation of Ozone Therapy and the International Scientific Committee for Ozone Therapy. The last one in the Declaration of Madrid, they speak long about all the protocols, how to prepare this solution. Nevertheless, the World Federation criticizes heavily this use because they say it's a very low amount of ozone. It generates dangerous oxidized products, and so it cannot be considered ozone therapy. I just leave you this as a topic for discussion. What do I do? I use 1 liter of Ringer lactate. I bubble it at 50 micrograms per milliliter for 15 minutes. And when applied to the animal, I still leave it bubbling. That's the protocol. I'm not that convinced in terms of performance uses. But with this administration, I had very good results with exertional myopathies, with liver pathology. I have a case report done with hypertriglycerides, which is something very difficult to treat and almost with no conventional treatments. And I have very good results with Ringer lactate. And finally, my last slide is just to tell you that I just use direct intravenous solution in the last 2 years of my veterinary career. I don't find studies about it, and I tend not to use things that are not protocol that the others didn't study. I use the DIV basically by speaking with other colleagues, listening to what the others do, and by curiosity, I did it. It's very easy to perform. I just apply a bacteria filter in the tube, and before I used it with 100 milliliter syringes, but now I just apply the tube coming from the ozone machine, the ozone generator, directly in the vein. And I put 1/8 to 1/4 per minute debit. And I do it that way just in order to see the reaction of the horses, but I can't speak that much about it because, in fact, there is lack of studies, and that's it. It's the last slide of my presentation.